Surgery for anal fissure. Is it required or just a medical management is enough? I am Dr. Dattaram. I am a consultant surgical gastroenterologist and laparoscopic surgeon practicing in Hyderabad. Many of the patients who have a fissure in ano heal completely after medical treatment. Many of them don't recur. But some patients, the fissure seems to be very recurrent. They keep on getting a fissure again and again after healing. And for some patients, it becomes a chronic fissure. It doesn't heal at all. So they continue to have pain despite using medical treatment, despite using a high fiber diet and a continuous sitz bath, etc. So the first sign of a healing fissure is that the pain will decrease. And once the fissure gets healed, that is, when the skin forms and the fissure heals, the pain disappears. But some people recur very fast after healing of a fissure because the skin which is formed is very weak. And if they are constipated, they are very likely to have the recurrence of the fissure. These are the patients who need to consider the surgical option. They may not completely heal or completely get rid of the fissure with medical treatment alone. What is the surgical treatment? Then why do we insist on medical treatment for a fissure is that try medical treatment for all patients with fissure because the fissure heals in majority of these patients and they may not have a recurrence at all. That is the reason why we always recommend medical treatment for a fissure to start with. What is the surgery for the anal fissure? I have already described and discussed in detail about the pathophysiology of a fissure and the medical treatment of the anal fissure. I have shared the link for the previous video in the description box. You can go and see the video to understand the pathophysiology and the treatment and the medical treatment of the anal fissure. The most commonly performed surgical treatment for anal fissure is lateral sphincterotomy or internal sphincterotomy, also known as lateral anal sphincterotomy. What do we do in this surgery is that the part of the anal sphincter, that is the internal anal sphincter, normally if you see there are two sphincters or muscle rings around the anal canal. The internal sphincter, which is basically smooth muscle and it goes into involuntary spasm when you have the anal fissure. This is the reason why the fissure doesn't heal. So there is another ring of external muscle also called as external anal sphincter, which is a skeletal muscle which is voluntary, that is you can actually tighten that, whereas the internal sphincter cannot be tightened by you. It goes into spasm when there is fissure by itself. So it is involuntary spasm of the internal anal sphincter. This is the main culprit why a fissure doesn't heal. So in lateral anal sphincterotomy, what we do is we are going to divide or cut this inner ring of muscle, that is the internal anal sphincter. So when we cut this internal anal sphincter, the tone of the anal canal is going to come down, the blood supply to the fissure is going to increase and the fissure is going to heal. So this is the best treatment for a fissure which is recurrent again and again or the fissure which doesn't heal at all. Lateral anal sphincterotomy is a very short daycare procedure or a short hospital stay procedure. It is done under spinal anesthesia. Generally, we divide only the lower half or the lower two-thirds of the anal sphincter. So this is called as a limited anal sphincterotomy. So we do this operation either by conventional open surgery or a subcutaneous sphincterotomy or a laser sphincterotomy. So any of them is equally good. This is a very simple operation. It doesn't need any lengthy hospital stay. It is done under spinal anesthesia or a short GA procedure. And there is no risk of bleeding or any major issue with this operation. This will completely relieve your fissure. You get rid of the pain, the fissure will heal and the fissure doesn't recur after the operation. So what are the complications of this operation? One important thing you should understand is that once we divide the internal anal sphincter, the tone of the anal canal is going to come down. So with that, there is some patients do experience a leakage of some stool or flatus or gas involuntarily without knowledge, but in majority of these patients this is very transient. This is going to improve in a few days to few weeks time in almost all of the patients. This happens because the tone of the anal canal is going to come down. So but this is the safest and the simplest operation for a non-healing or a recurrent anal fissure. So if you like the content, please like, share and subscribe and do share your comments and thoughts. Thank you so much.